name is Mitchell Bernstein. I'm an orthopedic trauma surgeon. I work at both the adult site at the Montreal General Hospital as well as the pediatric site, the Montreal Children's and the Shriners Hospitals. My main research focus is on outcomes research as well as value-based healthcare. I'm very interested in defining how much episode of care costs in healthcare, and then including that with quality metrics, and then of course defining the value.
How is data science reshaping healthcare, and what opportunities does it present for students in surgical and interventional sciences?
What's been interesting in my research is our ability to mine data across various information service software across hospitals has been very interesting, and the integration of where the information lies has allowed us to actually analyze the data. So I think as the software improves, we're able to actually take data, analyze it properly, and then produce something that's meaningful. Right now in cost data, there's a lot of data that's in multiple different siloed computer systems, and obtaining that information is actually quite difficult. So the software that's been developed, and McGill has purchased one of them from Australia, has allowed us to integrate and combine data, and thus allowing us to create meaningful data sets for analysis.
Why is improving surgical outcomes a critical priority in modern healthcare, and how can students contribute to this field?
Outcomes is critical for healthcare because otherwise we're just doing things, and in my field that those things are surgery, and if we don't focus on outcomes or value and what's important for the patient, so patient-centric outcomes, then it's not really relevant, you can say, or meaningful, because you as a surgeon may think it's important, but if you can't define the quality improvement or the value add to either patient or the hospital system, then it's very hard to justify doing the surgery. So outcomes research is critical to combine and integrate innovation, which costs money, but then justifying it with the value add or outcomes that are improved. And very critical to define metrics that are relevant for outcomes.
What opportunities do students have to learn and apply advanced research methodologies in evaluating surgical care?
I think there's a lot of ways we can collaborate. I think the word collaborate is good because as a surgeon, I obviously have a specific expertise that is not in, for example, accounting or data mining or, let's say, statistical analysis. So collaborating people who are business analysts, accounting, IT integration specialists, software management, things like that, is critical to, again, ensure the expertise is put around the patient, as opposed to using just me or just an administrator to define the outcome, because then it's going to be the user-centric, it's going to be user-centric and not the patient-centric. So we want to make sure we bring all the expertise that's relevant for the patient or for the outcome that we're interested in measuring.
Can you share an example of how surgical outcomes research has improved patient care and the role students played in that success?
Yeah, we have created a bit of a value-based research program in orthopedic trauma, and we've been able to define how much certain surgeries cost. We can now define, if you delay surgery, how much more that costs. We can then develop interventions to decrease the cost. We can analyze the patient's outcome and therefore the quality of the surgical intervention. The students have been integral in helping, because they've been writing the manuscript, they've been working with the business and finance team at the hospital, where we obtain the data, working with the data warehouse at the McGill University Health Center, and the accounting people, and then again defining all the areas in which we count or do the accounting for healthcare, and then putting it all together, writing up a final manuscript. It's been really impactful research.
How does studying surgical outcomes prepare students for impactful careers in clinical research, policymaking, or healthcare innovation?
If you can understand what matters, i.e. outcomes, then you're a very powerful, health advocate, very powerful politician, policymaker, administrator, physician, surgeon, what have you. Otherwise, you're sort of, blind in not being able to create feedback loops to evaluate if your intervention is relevant or a value add. I keep using the word value, which includes quality and cost. So outcomes, defining the outcome and then developing metrics in which you can measure outcomes is critical. Now you can integrate and collaborate with all kinds of people in the healthcare network. Very exciting.
Finally, do you have any messages to prospective students who would be interested in joining the program you would like to share?
I'm interested in students who are self-motivated, interested in outcomes research, value-based healthcare research, who are able to work with business analytics and finance and accounting, and then have a clinical side so that we're defining and measuring patient-centric outcomes.